Stories-TaylorDaphne Morsillo is a recent graduate of BCHS, and she also received her Global Health Certificate while she was here. While she was working on her MPH, she started working at the Allegheny County Health Department as a program coordinator for the Plan for a Healthier Allegheny program. In this position, she primarily supports the epidemiologist and the manager of special projects on their work with the Plan for a Healthier Allegheny, PHA. Previously, she served as a U.S. Peace Corps volunteer in Mozambique, which makes me very jealous. And her assignment was focused on health presentations in the community and local hospital, and working directly with an NGO, Provincial Department of Health, and the CDC. In addition, she served as Peace Corps volunteer leader, which created a linkage between Peace Corps staff and the volunteers. So with that, come on up.
Thank you all so much. There are some very inspirational people here today, and I feel a little out of my league. As a recent graduate, I just finished my MPH in December, defended my thesis less than 20 days ago. So alumni in a very loose sense of the word. So just a little bit about me. I graduated with my undergraduate degree from the University of Pitt at Johnstown, and had never heard of public health. I was a political science major. I was a soccer player. I thought I'd wanted to do physical therapy as well. So similar mindsets. And the only reason I had ever heard about Peace Corps was due to family members who had also served. So I knew that I wanted to apply, see what that was about, the cultural immersion and opportunity to serve, like the public service aspect of it. I always knew it was something I wanted to do. I was by pure luck of assignment that I ended up in Mozambique. I was originally slated to be a education volunteer in Ecuador, so I was going to teach English, and that program closed, and I was sent to Mozambique, having packed for Ecuador. So there I learned what a CD4 account was, what community needs assessments were, and the experience, the good and the bad. Well, that was Pitt Johnstown, sorry. The good and the bad, and oftentimes uncomfortable, hot shopper rides and discussing HIV and working in local health centers, you see some pretty interesting things. But during all of that, it molded my perception of what public health is. It showed me the various facets of this field and the day-to-day work that happens, and how it's all encompassing of just daily life. You can have a conversation with a mother about breastfeeding, and that's going to potentially impact how she feeds her child. And then you can joke around with young girls about talking to their boyfriends. That's also public health. So my work ranged from HIV education, like I was saying, HIV positive people to remain adherent to their medication, to working with a girls' youth empowerment group. That's a young girl learning how to put on a condom with a wooden penis. That was a hilarious conversation with a carpenter. Public health, all facets of life. So I applied to pick public health while I was overseas in Mozambique, using sketchy internet connections. I even took a paper-based version of the GREs. Yeah, that was interesting. So, and then subsequently deferred my enrollment for a year because I wanted to extend my contract to stay for a third year. I moved to a big northern city in the country and worked directly with the Provincial Department of Health and the CDC on a community-based adherence support network. Very interesting work, and all in all, one of the hardest experiences that I've had in my personal life was the readjustment back to the United States. For those of you who knew me upon those first few weeks at grad school, thank you. It's an odd statement to think, here you are leaving, this was my Giant Eagle, this was my Walmart, this was my market, to come back to hot running water, to electricity, to market districts. Who am I to complain? But something that's kind of stuck with me is the friendships and the relationships that I've cultivated that still exist to this day. I'm still in contact with a lot of people, and the projects that we worked on together and seeing how they're continuing to sustain, knowing that some unfortunately ended, but again, public health. Yeah, it was really hard to come back from that. So, Pitt Public Health, here we are. Like most processes of change, the first few weeks of graduate school were some of the most frustrating, sitting in classes for 2 to 3 hours as opposed to walking around in palm trees. In time, I sank back into the routine of going to classes, getting assignments done on time. I got involved with a lot of organizations here. International Dinner is a great opportunity and a fun event to go to in the spring. So there's many opportunities to get involved here, and our discipline studies and my certificate program really helped me kind of get back into the niche of living in the United States. This led to my practicum experience. I did the PSI experience with the Allegheny County Health Department. I worked in the Workforce and Development Training area with Jamie Sokol, who was my preceptor. The training program utilizes the core competencies for public health professionals as a platform for delivering the 10 essential public health services. This internship provided me an opportunity to work on training initiatives that supported staff across all programs and bureaus within the health department. It was a really interesting shift in perspective and a new opportunity to build some skills that I didn't have walking around in palm trees. So that experience subsequently led me to my current position as a project coordinator for the Plan for a Healthier Allegheny. As stated earlier, this position supports the epidemiologist and manager of special programs on the plan itself. So a day-to-day, it really ranges. I coordinate and prepare for the quarterly 5 priority area work group meetings. We have we have access to health, we have chronic disease and health behaviors, we have environment, we have maternal and child health, and we have mental health and substance use disorders. So it's a very, very encompassing plan, very wide-reaching. We have over 70 community stakeholders, as well as the work that the county health department is doing in our various locations. So these work groups also have subsequent small committee and task force meetings. I work closely with the members of our advisory coalition, our stakeholders, to update activity level progress. I manage the PHA work group activity tracker. It's a huge database of all of the projects and work that's happening in our community, in our county. And this helps to identify gaps in the priority work areas, and we can transmit that information to potential new stakeholders, to current stakeholders, and then develop programs and initiatives to address these areas. Recently, I've been involved in some exciting programs towards the expansion of health equity in our county. We recently presented information to the Dental Society of Western Pennsylvania on how to become enrolled to accept Medicaid recipients, focusing a lot on the attention specifically for young children and efforts to prevent future dental issues and need for costly reconstructive surgeries. Additionally, we're in the steps of launching a pilot program with several healthcare providers in the county that has 2 goals: to decrease the number of patients missed medical appointments due to transportation barriers, and to assist with transportation coordination for medical appointments. So, in summation, I am new to the workforce. I started this at the start of the school year. I also became the project coordinator, so it was a very interesting balance between school responsibilities and work responsibilities. Now I'm settling into a full-time position and kind of getting into the swing of things, and really excited to see where some of these pilot projects go. The kind of underlying moral of my story is that I never expected or planned to find myself in public health, but through a single decision made by the US government as to where I was going for Peace Corps, my whole worldview was shifted. And I think that speaks a lot to the public health world that we live in, and it provides daily opportunities to diversify ourselves, diversify our work with local and international communities, and just strive for a healthier tomorrow. Thanks, guys.